Hi, I'm Evan.
And I'm Laurel.
And you're listening to episode 550
with our dad,
Pharmacy Joe!
What's up, Pharmacy Nation? I'm Pharmacy Joe. Thank you for listening to the Elective Rotation, a critical care and hospital pharmacy podcast. This is episode 550. In this episode, I'll discuss a recent trial on surgery versus antibiotics for appendicitis. I have all the evidence supporting today's show linked up in the show notes at pharmacyjoe.com/episode 550. The question of whether some patients with appendicitis can be treated with antibiotics alone as an alternative to surgery is controversial. In an effort to bring clarity to this subject, a randomized trial comparing antibiotics with appendectomy for appendicitis was published in October 2020 in New England Journal of Medicine. The study was a non-blinded, non-inferiority randomized trial that compared a 10-day course of antibiotic therapy with appendectomy in patients with appendicitis at 25 different U.S. centers. The primary outcome was 30-day health status, and secondary outcomes included appendectomy in the antibiotics group and complications through 90 days. Over 1,500 patients were divided evenly between groups. Almost half of the patients in the antibiotic group were not hospitalized during treatment, and nearly all of the patients in the surgery group had a laparoscopic procedure. Nearly one-third of patients in the antibiotics group needed an appendectomy by 90 days, and complications were more than twice as common in the antibiotics group than in the appendectomy group. Despite these findings related to complications and the need for surgery, antibiotics were non-inferior to appendectomy on the basis of the primary outcome looking at 30-day health status. While the primary outcome indicated non-inferiority, an accompanying editorial in the same issue of the journal urged caution in choosing antibiotics over surgery. It's likely that surgery will still be considered first line for most patients after this study, but antibiotics may be an option depending on patient-specific circumstances. To access my free download area with 20 different resources to help you in your practice, go to pharmacyjoe.com/free. Thank you so much for listening. I'll see you in the next episode of the Elective Rotation.